The practitioner should wear the appropriate personal protective equipment: disposable gloves, apron, a suitable fluid-resistant mask, either safety glasses, safety goggles or a visor. Check with your own infection control team as areas may differ. You will need a height adjustable couch or chair with an adjustable backrest. Couch roll. And the equipment is wiped with a detergent wipe and antibacterial in between each patient. You will need a microscope or loupes, otoscope and single-use speculi, single-use Zollner suction tube, preferably non-fenestrated, as the fenestrated version has a risk of aerosol generation when in use. Fine ends, which are used for reducing the volume and also to reach the area nearer to the tympanic membrane. Gallipot, to put water into to flush the fine ends, and tissues. And suction liner and suction tube, which is appropriate for the apparatus in use. So only after obtaining a full history from your patient and assessing your patient is suitable for microsuction should the procedure be carried out. So you will need a microscope, or alternatively you could use loupes. Loupes are a portable version of a microscope whereby it enables you to be more, see people in a variety of settings, be more flexible. So the first one is more like a safety pair of safety glasses with visibility improved, leaving your hands free. That's an Opticlair. Then we've another Opticlair one, which if there's a large department and various people using the same loupes, you can alter the settings dependent upon the individual. So you can alter the eyepieces and the size of the headset with that one. And then you have a Vorotec. So that sits on the head, as does the Opticlair one, and you can view through the eyepiece with that. All of these are available on the Primary Ear Care website. At the beginning of every day, the practitioner should ensure that reusable equipment, for instance the couch, microscope or loupes, are cleaned with a detergent and disinfectant wipe. The wipes are also used in between patients before and after use. A new suction liner and suction tube is fitted. The suction liner should be set up as per manufacturer's guideline and checked it is working correctly. At the Ear Care Centre, we use both wall-mounted and portable suction units. Before the procedure, examine your patient's ear following otoscopy guidelines. Explain the procedure to the patient, including the nature of the noise. I would usually say this procedure should not be painful, but is very noisy. If you experience any pain, discomfort or dizziness, or would like me to stop for any other reason, please say stop, and I will stop, but try not to move your head. Switch on the microscope, ensuring that the arm of the scope is behind you and not over your patient. If the microscope is left in this position, should the hydraulics fail, the arm will fall and injure your patient. The eyepieces can be opened and closed like so. Each individual's eyes are different widths apart, and the movement of the eyepieces allows the practitioner to adjust the microscope to the appropriate distance. Looking down the microscope, you can see one circular image. If you do not see one full circle, you may need to adjust the eyepieces further. You can then use the handle under the microscope, moving inwards and outwards to obtain a good focus. This can take some practice. Select the most suitable size speculi for the patient's ear. Various sizes are available, and the largest size should fit comfortably into the external auditory meatus. Gently pull the pinner upwards and outwards to straighten the external auditory meatus. Direct the microscope towards the ear and insert the speculum gently. Assess the patient's ear and decide upon the most appropriate size of suction tape. Insert the Zollner suction tube onto the suction connecting tube. Really soft wax debris can cause the Zollner suction tube to become blocked. This can be cleaned using a cleaning pipe provided in each single-use pack, or rinsed through with warm tap water from the galley pot. Reposition the microscope to various different angles to inspect all of the meatus once all of the wax or debris is removed. The ear should be examined again following otoscopy guidelines. Your patient's presenting symptoms should resolve following wax removal. Advise your patient to return and seek further advice should they experience any further oral problems. If their hearing hasn't returned to normal within 48 hours following wax removal, they must inform you, as it is not the wax causing the problems, but could be something else.